You have low back pain and your doctor sent you for x-rays. You took x-rays and they said nothing was found. What do? Welcome to episode number 5 of Ask Dr. Walter. And before I get into the answer of this question, here's my x-ray facility. We take digital x-rays here. Here's the x-ray screen right behind here. The image gets sent to a computer. So we analyze our patients. One of the things we do with our patients is we do analyze their spine, their full spine, front and side by x-rays, and we get it analyzed and determined to see what the connection between their spinal alignment is with their actual symptoms and pain. So that was our x-ray facility that we have in there. We do digital x-rays. And this is episode number 5 of Ask Dr. Walter. Each and every day I'm going to upload a new video answering your question. Your question may be next. I'll take a question from one of the comments in my videos, so the comment sections, and what I'll do is I'll outline and feature that question in this episode series, okay? So be sure to comment if you have any comments or questions, and your question may be next. So let's get right into it. Here is today's question right here. This is by Janet, and this is what Janet says. Thank you so much for this video. I'm having this sharp pain lower back. I can't even walk normal for 9 days now. I've seen my doctor, and after some x-rays, nothing was found. Please, sir, what do I do? That is such a great question. I can feel the actual discouragement, and I can feel the annoyance in the actual question as it was read. And I can't tell you how many times I've had patients come to my office that have disc bulge type symptoms, back pain, leg symptoms. They have trouble walking and moving, and their life is just not the same because of their chronic pain. And they said, well, I already did x-rays, and they told me that x-rays didn't show anything, or that nothing is wrong, my spine's okay. Well, maybe that's the case. Maybe it's very possible. So I have to put that out there as a possibility. But another possibility is that something was missed. And I'm not saying that the results you got were not good results in terms of the interpretation of your x-rays. Possibly from a medical radiologist perspective, the x-rays looked perfect or good from a medical interpretation, which means there was no tumors, no fractures, no infections, no dislocations, serious pathologic conditions that require immediate medical attention. So as a chiropractor, when we take spinal x-rays, we do need to rule those out, but we look at it x-ray and the x-ray analysis from a different perspective, not just to rule out pathologies and not just to diagnose anything that is shown there blatantly, obviously, but we want to look at the actual spinal alignment, okay? So here's the most common mistake that I see with patients that already come to my office that have had x-rays done. So let's say the scenario is like this viewer here said, back pain, so sharp lower back pain. So they'll typically take a lumbar spine x-ray. Minimum 2 views. From the front, it's called AP, anterior posterior view, and from the side called the lateral view. Maybe they'll add additional views such as obliques possibly, and some sacrum spot views possibly. But let's just say a minimum of 2 views we're taking, which is the minimum amount of x-rays required for a diagnostic, front and side, okay? 2 opposing views. Well, your spine is not just a lumbar spine and sacrum and pelvis, which is the lower back region. Your spine is a complete full spine made up of 24 vertebrae from cervical neck region to thoracic to lumbar and sacrum. So as a corrective care chiropractor, I want to see what your entire spine is doing, from neck to low back, from the front and the side. I want to see what the cervical spine is doing, what the thoracic spine is doing. I want to see the alignment of the lumbar spine and how all those 3 areas actually connect and are aligned and actually correlate, okay? So let me put this a bit more specific. So the lumbar spine has a direct correlation with the sacrum and sacral alignment and sacral tilt, okay? More specifically, how the pelvis is tilted and related to the lumbar lordosis, okay? So that's something that needs to be addressed, okay? So we need to see the sacrum, the pelvis, and the lumbar spine. Now, the lumbar spine has also a direct correlation to what the thoracics are doing. So the thoracic spine will influence the actual lumbar spine because the thoracics, which is part of the thorax area and the rib cage, has large amounts of movement. So if it moves forward too much and misaligned forward, or moves back too much or misaligned back, or moves side to side, out of position in the coronal balance from side to side, that will influence the alignment of the lower back and actually trigger things like back pain. Now, with the upper thoracic area and the thoracic spine, now influences the cervical spine, okay? So if the thoracic is bending and flexing forward, can affect the neck. If the thoracic is extending back, can affect the neck and also the low back. Bottom line is, there are full spine correlations from pelvis, sacrum, to lumbar spine, to thoracics, and to neck. And even if someone only has low back symptoms or lower body symptoms, low back, lumbar disc damage, or leg pains, right? Lower body symptoms, we need to assess the full spine, okay? So if, quote unquote, nothing was found, the lower back x-rays were normal, well, what about the rest of the spine? And that's how I would address the situation, okay? And of course, not just look at it from ruling out pathologies, but also seeing what the actual alignment of the spine is doing, and correlate that with the clinical exam findings and the clinical case presentation, any other potential reports like medical reports or MRI reports, okay? So that's what I recommend in this case. As long as, if something was missed, then maybe some more further evaluation of the rest of the spine is required, same as postural observation, assessment needs to be required. What else in here? I'm not sure if the person here, Janet, actually pursued any treatment. That, of course, would help if you pursue treatment, professional treatment with either a chiropractor or physiotherapist, and get into some home exercise and home care on top of that. So you have a kind of a multimodal approach to healing this. That would also help as well, okay? So that's the answer to today's question in episode number 5. And if you've missed any of the episodes of Ask Dr. Walter, where each and every day I'll upload a brand new video that answers possibly one of your questions that you leave in the comments, or a question that people leave in the comments, my followers. So if you missed them, just go right here to this playlist right here to binge watch all the other episodes in the Ask Dr. Walter series, right over here.